like to introduce our speaker for today's breakfast, sponsored by Baptist Health. Michael Swartzon, MD, is a sports medicine physician with a dual board certification in family and sports medicine. He cares for active people, athletes, and individuals with musculoskeletal conditions. I hope I did okay on that one. He is an important player on your health team with significant specialized training to help you lead a healthier lifestyle. Dr. Swartzon cares for youth athletes, weekend warriors, active individuals, elite athletes, and non-athletes alike. He can maximize non-operative treatment, guide referrals to physical and occupational therapies, and if necessary, expedite an appointment to a surgeon for treatment. He has significant experience with professional athletes as a team physician for the Miami Dolphins, Florida Panthers, the jockeys at Gulfstream Park Racetrack, and a tournament physician for the Miami Open. And here's Dr. Swartzon.
Good morning. Thank you guys for letting me come and speak. I appreciate your time. I had fun in the previous breakout room. You guys seem like a very friendly group. Andrea, thank you for the wonderful introduction. I think my point today is to explain, what we can offer the community, so you and your family members. I'm going to share my screen, which has a little PowerPoint presentation. Can everyone see that screen? Can I get some thumbs up? Okay, great. All right. So who are we? I know we're new to this area of Broward. I've had an office in Davie for about 5 years, and now Baptist has made a bigger investment in the community healthcare here by having this large facility with multi-specialty physicians. But my orthopedic group started 30 years ago with Dr. Uribe, Heckman, and Vijek. Back then it was called U8Z Sports Medicine, and it was mainly out of Coral Gables at a hospital called Doctors Hospital. And then over the years, there's been some additional names attached to it. So Baptist Health South Florida, then the Baptist Health Medical Group, and now Miami Orthopedics and Sports Medicine Institute, sometimes is referred to as MOSME for short. This is all the same group. So maybe you've heard of it and driven down. The previous office was just on the north border of University of Miami campus. We now have several offices, most of them in Miami-Dade. This is our first full office in Broward, and wanted to take this opportunity to tell you about what our group does. So we are a complete orthopedic service line. The ones here highlighted in blue are the ones that are readily available here at the Plantation office. So we have a very experienced foot and ankle surgeon, Dr. Chapman, that can handle pretty much anything from the toe all the way up to the knee. We have a hand surgeon, Dr. Roy Cardoso, who is very accomplished in anything from the tip of your finger to your elbow. We have Doctors Uribe and Dr. Yagnik, who handle sports. And sports is a very broad term in orthopedics. So mainly they handle knees, shoulders, and elbows, but it also includes things like hamstring or quad tears, clavicle fractures that are complicated, pec tears, anything that you could think of that's most likely a sports-related injury, those two can handle. And then there's Dr. Rodriguez and I, and we're in the primary care sports medicine, which is a little bit different field of medicine. So these are the 6 physicians that are currently here in the office, so you can kind of put a face to the name. We do have 2 orthopedic surgeons coming in the next couple of months. One you may have heard of is Anne Ouellette. She's a very well-respected hand surgeon that will be adding to her presence up here in Broward. And then Dr. Ross, who's over at FAU and Boca Orthopedics, and he specializes in hip preservation, hip labrum, and some sports medicine. And one of the important things with some of these physicians is that on the second floor here, there is an ambulatory surgery center. So there is a possibility of you being able to have your pre-op appointment here, your operation here, your post-op appointments, and we also have physical therapy on the same floor as us. So this could be a one-stop shop depending on what your needs are. As far as what Dr. Rodriguez and I do, we cover a lot of things. So most of the time, if you were to call and you had an injury or an issue, you would probably see me or Dr. Rodriguez. We're the ones who try and figure out what's going on with you. And is it a surgical or non-surgical problem? Because you may want to see, the best name in our group, but that person may not be able to handle your request or your issue. So we will figure out what's going on. If you do need surgery, we will have you go to the best surgeon for that particular problem. But otherwise, most things don't need surgery. So, Dr. Rodriguez and I cover a lot of sports. One of the taglines for the group is "Go where the pros go." Again, we're not here to try and brag or be arrogant, but I want you to understand that we're under a lot of pressure to take very good care of these athletes, whether they're high school, college, or professional. We take that experience and use the same treatment algorithms to help you. So when you come here, you're getting the people that do this for basically the highest level athletes that we have. This is kind of a screen to give you an idea of what the range we can cover here. Again, this is not an exhaustive list, but you got to understand that 90% of everything that comes into our office does not need surgery, which is great for you and great for me because I cover that 90%. If you have a stress reaction or an overuse injury of the elbow from tennis, or whether you have an arthritic knee, these are all things that we handle, as well as some other complicated things that might be more common to your kids or grandkids, depending on your age, things like sports-related concussions and that kind of thing. Certainly one of our unfortunate expertise has been clearing athletes after they've had COVID infections, and I think we're up to 180 athletes now that we've had to see after they had COVID. Luckily, they're all doing well. But certainly it's an interesting year for us as far as sports medicine is concerned. One of the biggest things that people ask us about is what is the latest treatments? And a lot of times people will go and they'll do this medical tourism and go to Panama or Vail to get these very expensive stem cell procedures. We do have them here in-house. We do those, whether it's the PRP plasma or bone marrow or the amniotic. We do have those here. So there's no reason for anyone here in the chamber to have to travel to get these expensive treatments elsewhere. We have very, very affordable prices here locally. So I know there's some breakout rooms and I'll try and stay as long as I can, but I'm happy to answer any direct questions now if anyone has any. These Zooms are always very difficult. I can't really read the room as well as if we were doing this in person. And I promise you that if we did do this in person, we'd have some nice food for you too.
Good morning, Dr. Swartz.
Yes, go ahead.
Hi, morning, Martelli here. We happen to have an injury at our family. My wife was coming down the stairs the other day and she twisted her foot. We went to the emergency room in Coral Springs. She had fractured it. I just really like the approach that you brought up. Do you, as far as insurance, do you accept anything? What do you accept typically?
So we have, baptisthealth.net/ortho has If you search me or any of my colleagues, it lists the plan that we take. You're always welcome to call and ask specifically. I got to tell you, the longer I'm in practice, the more I feel the amount of insurance plan has mushroomed with the marketplace. Um, I could say that we take almost every insurance that's around, but we don't take all of them. We take Medicare, we take United, Blue Cross, Humana, Cigna, Aetna, um, pretty much all the big players, that are out there. We take. Um, I don't think we take all of them, and there's certain subsections of each one of those that we may not take, and I wish we could take everybody. I'm an employed physician. One of the benefits of being an employed physician is I don't really look at what your insurance is or your financial
Right.
situation. I
Sure,
just
sure,
give you the best care I can.
sure. Thank you so much. I'll reach out to the office because we were actually looking for a different ortho.
Yeah, I'm sure someone here can get you a direct contact to us, so you don't have to go through the main number, so we can answer you directly. Yeah,
Okay.
I
Thank
think
you,
Kate
Thank.
may be able to help you, or Carrie.
Thank you.
Robert, you had a question?
Yeah. Do you treat employees who are injured at work?
So the workers' comp cases, we do see workers' comp mostly on a case by case basis because some of them we're here to help. I see car crashes, I see people injured at work, but some of those cases get very litigious and complicated. So if it's something that's new, I'm definitely willing to see the injury. If it's something that's a year or two old, chances are I can't be of much assistance. I think all of us deserve to get the best care, but there's a lot of doctors that shy away from some of those injuries where there's an enormous amount of paperwork and things are usually pretty complicated. But I'm definitely I look at those on a case by case basis.
Great. Thank you.
Anybody else have a question? Okay, thank you so much, Dr. Swartzon. We really
You're very
appreciate your
welcome.
time, and we hope we got you out of here on time.
Oh no, that's perfect. Yep. Thank you very much.
You're
Andrea.
welcome.
We're here for you. We're growing. Baptist also has urgent cares if that are. I think there's one in Coral Springs that's a little closer to where you guys are. And if you need something urgently, you can go there, and then you can have a follow up with us for any orthopedic needs or physical therapy that you have.